Hi all, it's Olivia and I'm presenting my last CEER on the impact of a positive youth development program in urban after-school settings on the prevention of adolescent substance use. Positive youth development emphasizes a strengths-based approach to the promotion of positive outcomes for youth. This perspective doesn't view youth as troublesome and in need of fixing, but instead emphasizes their resilience and value to others and to their community. Although the positive youth development perspective initially declined to focus on risk reduction and prevention, because these approaches characterize adolescents as having problems, more recently there have been calls for the integration of PYD and prevention science perspectives. About 14 million children and adolescents regularly spend time after school without the adult supervision. Approximately 4 million of these are 13 and 14-year-olds. Research has shown that unsupervised out-of-school time is associated with various negative youth outcomes, such as involvement in risky behaviors of substance use. Adolescent substance use in particular has been linked with unsupervised out-of-school time, especially among youth with low levels of parental monitoring. Structured after-school programs for youth have been developed to address the potential risks posed by the lack of adult supervision, particularly among urban youth. Recent research has also suggested that some after-school programs may reduce substance use among adolescents. This study examines the Positive Youth Development Collaborative, which specifically targets substance use attitudes and behaviors among urban minority adolescents. This program involves the implementation of an evidence-based curriculum embedded in a comprehensive after-school program based on positive youth development principles that is intended to prevent substance use. The program teaches substance use prevention skills along with participation in health education and cultural heritage activities. The core substance use prevention component of the program is an 18-session curriculum that covers topics such as learning the steps of effective decision-making, identifying social influences on decision-making such as peer pressure in the media, learning essential information about tobacco, alcohol, and other drugs, and applying the decision-making process to one's life. The curriculum was a part of an overall after-school program that included regular field trips to community agencies, civic organizations, businesses, and schools to promote learning about community service and understanding one's cultural heritage. The adolescents completed a pre-test interview, an exit interview, and then a follow-up interview 1 year after the initial interview. There were two groups, the intervention and control groups, and the control group also did participate in an after-school program, just did not receive the 18-session curriculum. There were 304 adolescents, half were in the intervention group, 53% were male, and the average age was 14.5 years. 76% were African American, 20% Hispanic, and 4% white. Measures included substance use attitudes such as risk of harm and drug beliefs, as well as past 30-day use of substances. Results indicated that there was a significant increase from pre-test to exit in the perception of risk of harm for the intervention group compared with the control group. Both groups showed a significant increase in that score at follow-up compared with pre-test, but this did not differ by group. Neither group demonstrated a significant change in drug beliefs at exit or follow-up compared with pre-test. The odds of using alcohol was 63% less for the intervention group. Marijuana use significantly decreased at exit and increased at follow-up when compared with pre-test. This change in use at exit did not differ by group, but the intervention group showed a decrease in use compared with the control group at follow-up. Although the odds of marijuana use at follow-up increased by a factor of 1.45 for the intervention group, the odds of marijuana use increased by a factor of more than 8 for the control group. There was a significant overall decrease in the use of other drugs at exit compared with pre-test, which did not differ by group. However, there was a significant increase in other drug use at follow-up for the control group. Although the intervention group also increased in other drug use at follow-up, the increase was significantly smaller. So in sum, the present study showed that a positive youth development intervention that included an evidence-based substance use prevention component adapted for an urban after-school setting was effective in preventing adolescent substance use. Adolescents participating in the intervention were more likely to view drugs as harmful at program exit and showed a reduced incidence of past 30-day use of alcohol, marijuana, and other drugs, as well as any drug use 1 year after the program enrollment. Although there were increases in use in both groups, the increases were slightly less in the intervention group than in the control group. In some, adaptations of similar programs hold promise for use in other after-school programs. Thanks for watching.